Welcome to Lifestyle Matters. I'm Marilyn Moore. Today we have Dr. Dunklin with us, who is a general orthopedic surgeon with an emphasis in sports medicine. And today we're going to be talking about rotator cuffs and all there is to know about rotator cuffs and the different surgery options that they have. And I know I have a lot of family members that have had surgery on their rotator cuff, so I know this is a common injury people have. So I'm sure you're very busy, Dr. Dunklin, and thank you for coming to the show.
Oh, you're welcome. Rotator cuff injuries are becoming, and always have been, a complex problem, especially as people age and remain very active. So that's one of the things we try to do is keep them active.
And what exactly is a rotator cuff?
The rotator cuff is a complex connection of four muscles that are responsible for moving the shoulder in all planes of motion. And as most people know, the shoulder has a lot of motion to it. It's one of the most mobile joints in the body. But being so mobile, it's very susceptible to injury and overuse.
Who is most prone to a rotator cuff injury?
Certainly, overhead athletes are commonly considered prone for injuries to the rotator cuff. Labor positions, workers, weightlifters, people that exercise a lot are more prone to injury as well.
Is there a way to avoid injury or any type of pain?
Well, that's interesting. A lot of overhead activities will certainly aggravate the rotator cuff mechanisms. Certainly, younger people get away with this because they're young. Older people, as we age, things don't quite heal as we once did, as we all know. And once you have an injury, it takes longer to heal. And in some cases, it can get to the point where it actually tears and possibly could result in something surgical.
So is surgery always the option, or is there alternatives?
No, surgery is not always the option, and in most cases we try to avoid surgery unless it's something obviously major or incapacitating to a patient. But most rotator cuff injuries, I shouldn't say most, but a lot, can be treated non-surgically with rest, medications, sometimes physical therapy exercises, and I tell my patients avoidance of repetitive overhead motions.
I've always been a tennis player, so I did injure my shoulder about 3 months ago actually playing tennis, and it took about 3 months to heal, but I said, absolutely not, no surgery, so I did all my exercises I had to do, I iced it, and it was, I mean, I'm good to go now. But if you do need to have surgery, what are the different options that you have?
There are a couple options for surgery. The old gold standard used to be an open repair, which required making an incision, dissecting down, getting to the rotator cuff tissue itself, and repairing it with sutures and various anchors. Newer techniques include arthroscopic surgery, where you're able to go in through smaller incisions that reduces morbidity and pain levels. And you can get equally as good repair in some cases. Some cases still require an open repair. But with modern suture anchors, devices that we use to repair the tendon back down to the bone, results have improved significantly with the arthroscopic repair.
And what is the healing process like?
The problem with the rotator cuff, and the reason why it's significantly involved with people's lifestyles, is the blood supply is somewhat limited. And any tissue that has a limited blood supply takes a long time to heal. I'm telling my patients if they have to have a surgical repair, it could take 10 months to a year for full repair. And that's just the amount of time it takes for the blood supply and the healing to occur. Now, that doesn't mean they're incapacitated for 10 months, but they're certainly restricted from doing certain activities while it is healing. That includes to continue with an aggressive rehabilitation and strength program, but under close supervision, usually with a therapist.
And, I mean, is there a way to speed up that healing process at all?
Unfortunately, there is not a direct way. Of course, don't be a smoker. Smoking will definitely delay your healing capacity. That's true for any surgery. Certainly a healthy lifestyle, avoiding heavy and overhead repetitive motions. There's nothing you can do about your age, but probably smoking and certain vigorous activities would delay healing.
And why do you love working with Fresno Surgical Hospital?
The surgery hospital is a great place to work. They certainly have an emphasis on a lot of orthopedic cases. They provide quality care. They have most of the up-to-date equipment for orthopedic cases. It's a great facility. Most people are keyed into orthopedic procedures. They have a great personality, very efficient. And it's also supplies if you were to need an admission, a great place to stay overnight or a day or two for hospital care without the burden of being in a big city, large hospital, which can sometimes be overwhelming.
I've only heard great things about Fresno Surgical Hospital. Doctor, thank you so much for joining us.
You're welcome. Thank you.
You're watching Lifestyle Matters. I'm Marilyn Moore, and we'll see you next time.